Hello, this is Dr. Arti Kandolkar. I'm a consultant psychologist and a counselor. We have already discussed various facts about schizophrenia. What is schizophrenia? What are the symptoms of schizophrenia? What may be various types and form that it may occur? Okay. So today we are here to talk about myths and facts about schizophrenia. Okay. So there are very popular myths. So let's try to understand them. Okay, one at a time. The very first one is schizophrenia is a split personality. So is it true? So the answer is no. Okay. Schizophrenia maybe it is called because there is a split in their thoughts, behavior, okay, and emotions. But it is not a split personality. Technically, split personality means dissociative identity disorder. Okay, or you can also call it a multiple personality disorder. This is a officially correct thing. Is an extraordinarily rare. It's not very common. Okay, it is quite distinct from schizophrenia. So since we are discussing about schizophrenia, this is not a split personality. Okay, schizophrenia is basically a thought disorder, something related to there is a breach into the reality in our thoughts. The myth likely to stem from the fact that schizophrenia, there is a breakdown or split between the thoughts, emotions, and behavior, as we already discussed. So be careful about this rather than calling somebody with split personality or split disorder. You can say it's just a schizophrenia type. Okay. Myth number 2. Okay. Violence is very common with schizophrenics or person with schizophrenia. So this is also not true, okay, because it actually rare that somebody with schizophrenia will be violent. Yes, they get triggers, no doubt, but it is not so common as it is depicted. Okay, it's like an individual with schizophrenia is much more likely to be a victim of violence than actually creating a violence, since they suffer from lot of this psychotic symptoms and all. Sometimes family do not take care of them, or they are on the streets or in some hospital, or maybe not living in a enough good life. Okay, so this is like they are actually you can say they are mostly a victim rather than one who creates the violence. Okay, they may be homeless, staying in a shelter where they may be signal out, okay, or assaulted. So they are not commonly violent creators. Okay. The next, there is a myth that person with schizophrenia cannot hold a long-term job. Okay, that is also not true, because when you treat the schizophrenia, and especially in an earlier stages, a person can be symptom free. Yes, you cannot cure the disease, but this disease of schizophrenia can be definitely managed well. Okay, and hence they can hold on to the job. Actually, let's see what it says. Actually, some individuals, when stable, that means they are treated with medicines and all, with therapy, they are able to function quite well. When they are being complement with their medicines and are engaged in some of the psychosocial treatment, they often are quite functional. They can take responsibility of the family, they can study, they can work, okay, do all sort of work. Working appears to help people recover from schizophrenia rather than not working. Okay, it will not help the person much, but when they work, take up the job, and take medicines and whatever their treatment regularly, they are able to function well. Okay, and research advances in vocational rehabilitation activities. Okay, rehabilitation centers are there where they create cognitive retraining and all. Okay, they are made more functional. Counseling is going on, so all this helps them a lot. And this vocational rehabilitation have been shown to be effective according to the research. Okay, not only personally and also economic wise, means it helps them to earn some money. Also, a growing body of research supports that concept that Empowerment is important component of recovery process. So according to the even the research, the scientist says it's important for the better recovery, they should be engaged in some activity. Okay. So they can definitely hold on to the job provided better treatment methods are available. The fourth myth is schizophrenia is very unpredictable. That means person with schizophrenia is very unpredictable. They can act out sometimes, they may be quite depressive or sad at sometimes. So let's see what is the reality. A sudden dramatic changes of character in individual with schizophrenia is not the usual scenario. So it is not something usual. Okay. It's common for the signs and symptoms of that mental disorder to surface over the time. So it is like it's not possible that the person will be in the symptom like in depression or maybe in a mania sort of a thing, and they act out or they are very unpredictable to stay with. It's not so. There may be some subtle signs and things and they may surface over the period of time. It's not quick. Okay. There's often soft signs. Okay. See, there is soft signs, maybe the person who is staying with schizophrenia. Obviously, they have to be aware of what can happen. If they observe these minute signs initially, okay, they will be able to handle that. Okay. In the typical progression of illness, person may first become flat, isolated more frequently, and decrease their participation in activities. So just like prodromal phase, okay, there is always a prodromal phase wherein the person is in the withdrawal symptoms, like he is not interested in activities, doesn't want to take care of his body, like grooming and everything, doesn't like to eat properly, sleep properly. All this are the subtle signs and symptoms. You have to pay attention to this. I know it's very difficult to any new person or parent to identify this. Okay, but you already had a suppose this kind of a symptoms in that person in the past. The second time you can be aware. Okay, this is called prodromal phase. The psychotic break could occur from a stressor to full active phase takes over months or years. So this is like there is a psychotic break that can happen. Okay, from any stressor, ongoing stressor, maybe a death in the family or some accident or some other you can say abuse or thing which is very severe. But to occur from that event, like suppose failure occurred in an examination, to actually come to a full blown schizophrenia will take lot of time, even months to years. Okay, and prior to that, what you can observe is for prodromal stage. The next is the fifth myth. Okay, schizophrenia requires long-term hospitalization. Is it fact that every person who suffers from schizophrenia requires hospitalization for a long term or lifetime? So the answer is no, because there is lot of outpatient care now is available. Acute hospitalization may be necessary, and longer term hospitalization only when it is needed. Not every patient suffers from severe symptoms. Okay, some may be milder, they can function well. So according to the need, okay, you can hospitalize the person, but not always long term. Okay, outpatient is right now is very common. Currently, treatment model for schizophrenia is moving away from long-term hospitalization towards outpatient treatment, as we spoke. At times, individual may benefit from going to daycare program, okay, or a partial day hospital and receive daily treatments. Okay, at home it can be better managed. Therapy may vary from individual to group therapy. Medication of choice is usually second generation antipsychotic agents. Okay, so this is what we can see. It's not always a long term. The next is myth number 6 is bad parenting causes schizophrenia. This is also very popular with autism also. They say parents are the cause for people suffering from autism or, as we say, schizophrenia. The answer is big no, because parents are not responsible. One way you can say the parental genes, because parents are suffering, they have given you the genes of like schizophrenia, but they directly, because of just parenting, cannot cause schizophrenia, and it is well researched. Years ago, it was believed that mother or both the parents were responsible if the child develops schizophrenia. Okay. Now, it's no more fact. While there is a genetic susceptibility, yes, the disorder tend to run in families. This we know. Okay. There is absolutely no evidence that is caused how the person is being parented. If both the parents, even if both the parents are schizophrenic, okay, or suffering from schizophrenia, the chances are hardly 20%. Okay. Plus, even if your parent have schizophrenia, chances of getting is less than 20. So it is like maximum 20%. So what does cause it? So what is the reason for this cause? So there are various reasons that could be identified and not one reason. I know this is not very happy answer, like, but yes, the environmental factors. At what age you started having intoxication, like drugs, okay, or you were some medicines for some severe illnesses, or the birth history, okay, and your genes all can contribute to your having schizophrenia. Okay, even the some environmental factors like your academic stressors can cause it if you're already susceptible to things. Okay, so this is what the 6 facts are, or myths. So far we have covered all the myths, okay, the major myths about schizophrenia. If you like the videos, please do like, share and subscribe.